I've got 30 seconds to introduce our next speaker. Our next speaker is Rochelle Davis, who is the president and CEO of the Healthy Schools Campaign. I've got to tell you that she is a children's wellness and environmental health leader. I asked her what 2 things would she like you all to know about her. She told me there are 2 things that she wants you to know. The first is the most important thing to her are her kids and her husband, and I believe her son, her mother, and her husband are here. Wave hello to the audience. She's also very concerned about making the world a better place, so I thank her for her leadership and for all of her work. I have to introduce to you Rochelle Davis. Thank you.
Thank you so much. I am the president and CEO of the Healthy Schools Campaign, a nonprofit organization dedicated to making schools healthier places for all students. We, along with many of you here in the room, have been partnering with the Chicago Public Schools to create healthier schools and address health disparities. We are so honored that the U.S. Department of Health and Human Services Office of Minority Health has chosen to highlight the work Chicago Public Schools and its partners are doing here in Chicago. Now, common sense and our experience with our own families tell us that healthy students are better prepared to learn, focus, and achieve. My son, who's walking around, will tell you how much I harped on eating a good breakfast before he went to school. But increasingly, research is telling us the same story. However, not all students have the same chance to be healthy. Health in our country is greatly impacted by your race, your ethnicity, and your income level, and where you live and go to school. Too many students lack access to regular medical care, miss meals, or don't have access to healthy meals. Many students also do not have the opportunity to be physically active and play. These conditions are negatively impacting the long-term health of our nation. Child obesity rates in Chicago and the country have skyrocketed, and we have some of the highest childhood asthma rates as well. Both of these health crises disproportionately impact low-income minority students and gravely affect student readiness to learn as well as their lifelong health. In Chicago, our student population is highly vulnerable, with more than 80% of students being both low income and minority. Now, this morning, we have the opportunity to discuss health disparities, their impact on student achievement, and what schools, cities, state, and the federal government can do and should be doing to address disparities. First, we will hear from Dr. Gail Christopher, Vice President of Program Strategy for the W.K. Kellogg Foundation, who will talk about the social determinants of health from a racial equity perspective. Then we will hear from Dr. Charles Bosch from Columbia University Teachers College on the connection between health disparities and academic achievement. Then Terry Mazzani, CEO of the Chicago Public Schools, will share with us how the district is addressing these issues. Finally, Dr. Shuker, Commissioner of the Chicago Department of Public Health, will share his thoughts on the role the public health community can play in supporting schools. After the formal presentations, we will have a short panel discussion.